The Ministry of Health has indicated that at the moment, no second doses of the Sputnik vaccine is available. However, persons who have already accessed the first doses should not be concerned since the booster doses will be in the country next month. And the minister is also assuring that the extended time that persons will have to wait to access a second dose will in no way affect the overall effectiveness of the vaccine. As a matter of fact, it is in keeping with the new usage guideline for that jab.
Initially, the advice that we received from the Russian authorities were that second dose, you do it at an interval of 4 weeks. During this week, they have written to us to say that you can extend that interval from 4 weeks to up to 12 weeks. So anytime between 4 to 12 weeks, you can get that second dose.
The minister assured that a restock of second doses of the Sputnik vaccine are expected to arrive in Ghana in the new week.
We are hoping that by next week we'll be able to get those supplies in. We'll start rolling out those second doses.
According to reports coming out of the Ministry of Health, Guyana has so far received 370,937 doses of COVID-19 vaccines in the last 4 months, enough to vaccinate in excess of 180,000 persons. This comprised 205,000 doses of the Russian-made Sputnik vaccine, 145,400 doses of the Oxford AstraZeneca vaccine, and 20,000 doses of the Chinese Sinopharm vaccine. To date, less than 200,000 persons have been vaccinated according to reports from the Ministry of Health. As it relates to the Russian Sputnik vaccine in April, Ghana received 138,000 doses, and then on May 18th, an additional 67,000 doses of the vaccine arrived in the country. With regards to the Oxford AstraZeneca vaccine, on February 10th, Barbados gifted Guyana 3,000 doses. In March, another 80,000 doses arrived from India, and later on in that same month, the COVAX facility supplied 24,000 doses. On May 11th, a further 38,400 doses were gifted from COVAX. Guyana is also in receipt of 20,000 doses of the Sinopharm vaccine. To date, the ministry has announced that less than 200,000 persons have been vaccinated. The Ministry of Health has also announced that it has exhausted first doses of the Oxford AstraZeneca and Sinopharm vaccines, which leaves the availability of only second doses of these vaccines. The minister asserted that there are also adequate AstraZeneca second doses, since, depending on the quantities received, equal amounts were set aside for first and second doses.
We took half of it and we set it aside for persons' second dose. And then we used the other half to give out as first dose. Most of that we have given to people, and because you have that time interval between 8 to 12 weeks, we have kept back your second dose.
By the second week of June, another shipment of the AstraZeneca vaccine are expected from COVAX. The government is also exploring several other avenues to secure more vaccines, Dr. Anthony explained.
Been talking to the African Union, and through that arrangement, which was brokered by CARICOM, Guyana was allocated approximately 149,000 doses. So we are working on that arrangement. We've had to make an initial payment, which we have done.
As on Thursday, 194,749 persons had been administered first doses of the vaccines. 65,534, or 13.5% of adults, have been fully inoculated. Meanwhile, the COVID-19 field hospital provided by Qatar, which arrived in January of this year, is not yet in operation. According to Dr. Anthony, the Lillian Dahl Hospital currently has adequate capacity to accommodate patients requiring critical care. However, if the hospital becomes overwhelmed at any point, it will be supported by the field hospital. Temika Rodney reporting for the HGP Nightly News.